Well-being. Being well. Broken heart syndrome. Broken heart syndrome, clinically known as Takotsubo cardiomyopathy or stress-induced cardiomyopathy, is a temporary but potentially serious cardiac condition triggered by intense emotional or physical stress. Although it presents with symptoms similar to those of a heart attack, such as chest pain and shortness of breath, it differs in that it does not involve blocked coronary arteries. Instead, the condition reflects a profound interaction between emotional trauma, nervous system activation, and cardiac function. Physiologically, broken heart syndrome begins with an acute stress response. Intense emotional events, such as bereavement, relationship loss, or traumatic shock, activate the sympathetic nervous system, leading to a sudden surge of stress hormones, particularly adrenaline. This excessive hormonal release can have a direct toxic effect on heart muscle cells, temporarily impairing their ability to contract effectively. As a result, the left ventricle, the heart's primary pumping chamber, may weaken and assume a distinctive balloon-like shape, reducing cardiac output and producing symptoms that closely resemble myocardial infarction. Despite the absence of arterial blockage, broken heart syndrome can be life-threatening and requires immediate medical attention. Symptoms may include chest pain, palpitations, fainting, and difficulty breathing. The condition highlights how emotional stress alone can precipitate significant physiological dysfunction, underscoring the importance of emotional regulation in physical health. Psychologically, the onset of broken heart syndrome is typically preceded by overwhelming emotional trauma. Grief, shock, anxiety, and profound sadness may dominate cognitive and emotional experience, leading to sustained physiological arousal. Chronic stress or unresolved emotional processing can prolong nervous system activation, exacerbating cardiac strain and slowing recovery. Depression and anxiety may also emerge during or after the episode, further complicating healing. Neurologically, emotional trauma associated with broken heart syndrome affects multiple brain systems involved in stress regulation and emotional processing. The amygdala, which detects threat and emotional salience, may become hyperactive, intensifying emotional responses. The hippocampus, responsible for memory integration, can be affected by prolonged stress, influencing emotional recall and regulation. The prefrontal cortex, which supports decision-making and emotional control, may function less effectively under extreme stress, reducing the individual's ability to modulate emotional responses. Alterations in neurotransmitter balance, particularly involving cortisol, serotonin, and dopamine, further contribute to mood instability and stress sensitivity. These neurological, psychological, and physiological processes interact through reinforcing feedback loops. Emotional distress heightens physiological stress responses, which in turn amplify emotional vulnerability. When prolonged, this cycle can increase the risk of long-term mental health conditions such as depression, anxiety disorders, or post-traumatic stress symptoms, and may also influence future cardiovascular risk. Recovery from broken heart syndrome typically involves both medical and psychological intervention. Medical treatment focuses on stabilizing heart function and reducing cardiac strain, often through medications such as beta blockers. Psychological support plays an equally critical role, helping individuals process emotional trauma, regulate stress responses, and develop adaptive coping strategies. Therapeutic approaches such as cognitive behavioral therapy, mindfulness-based interventions, and supportive counseling can aid emotional recovery and reduce the risk of recurrence. Broken heart syndrome illustrates the profound interconnectedness of emotional experience and physical health. While the condition is usually reversible, it serves as a powerful reminder that emotional trauma can have tangible physiological consequences. Addressing both emotional and physical dimensions of healing supports recovery, resilience, and long-term well-being, emphasizing the necessity of integrated mind-body approaches in healthcare.